to see, you know, how you walk families through a lot of these conversations.
Thank you. And Rachel did a fantastic job this morning in unlocking the secrets, right? Can I come?
Hi, my name is Megan. I'm the research coordinator and specialist for the Madison study, which is an adult onset leukoencephalopathy. But I do definitely find the families quite impacted with this diagnosis.
Hi, I'm Abigail. I'm also from the Catastrophe Consortium from the University of Wisconsin-Madison.
And I'm Noah. I'm also from the Catastrophe Consortium study, also at the Madison, Wisconsin site.
I'm Ivan. I'm with the Catastrophe Consortium, but I'm in Georgia out of Atlanta. And I'm attending this also just personally, being a parent who lost a child and seeing the grief that led to their ultimate demise of the relationship. So I'm kind of curious about the mental health and how it's managed.
Thank you.
I'm Harmony. I'm a clinical research intern at Lurie's, work in the same department as Sue, and she recommended this conference for us. So just learning everything about leukodystrophy and how it affects families and dynamics. So.
Hi, I'm James. I also work at Lurie's with Sue and the rest of the team, and I'm here for the same reason.
It has benefits to be local.
I do patient advocacy at Hospital Therapeutics. We're conducting a clinical trial of gene therapy for canavan disease and very leukodystrophy. I'm also a psychologist and very interested in the area of mental health and rare disorders, of which there is a very scarce literature and need for more work. So I'm delighted that you're presenting and that this is the feature of the ULF conference. But I don't work in the Cancer research program at any site.
I love to talk to you after, you know,
Yeah.
to develop more about collaborative.
Yes.
Julia, I just finished up child neurology residency actually at CHOP, and I'm signing on as a research fellow. This is actually my first time at this conference.
Great. Oh, yeah.
Lauren, you want to introduce yourself?
Oh, okay. I'm Lauren. I'm a child life specialist and grief counselor, and Sarah and I just did our talk earlier this morning.
On supporting siblings. Lauren, like, incredible job.
Likewise.
Well, thank you so much for everyone coming. Do you think that we should maybe get started?
So I'm gonna read the one online.
Oh, perfect.
I had them just type in if they want.
Sure.
And online we have Katie Harrington. And she said, I'm Katie. I guess you could say I'm the best of both worlds. I'm a parent of a child with leukodystrophy. And I also have autosomal dominant leukodystrophy. I found out about both of our diagnoses at the same time. I was already experiencing mental health issues due to a brain bleed he experienced at 6 months of age. But then to find out I was living with and had also passed on this devastating disease to my son, and prior to pregnancy, I had an unspecified diagnosis they didn't think was very serious. My son's medical team tells me I'm stressing so much, but how do you expect me to feel when I get this news? I couldn't have prevented it, and I may lose my son without a cure. How can you deal with that? I can't. It's hard. I've tried multiple medicines over the years and nothing works for me. Now I'm wondering if it's my brain making it impossible. Thanks, Katie.
Thank you, Katie.
And then there's Jason Child, parent of a 15-year-old Alexander disease patient. And we have 2 more families online. Not yet. So I don't see anything else in the chat, but thanks.
Okay, so let's get started. Go to the next slide. We're definitely going to introduce ourselves. It's 3 of us presenting. Okay, and so Marcy, the parent, is going to tell you about her story. Sarah's going to tell you her extensive story of being a social grid CHOP, and then my experience at Lurie Children's in downtown Chicago in the Leukodystrophy Clinic. We're also going to be talking about tools, building the team and being discerning about who you include in the team. Community resources, because more and more there's new great extensive resources, navigating challenging relationships as well as positive practices. Personally, when I was starting, our leukodystrophy center was opening up in Chicago. I reached out to Sarah because of her experience and you know, all the leukodystrophies are difficult conditions, but one thing that Sarah told me as I was learning about, you know, resources and things that could help families, she said to me, it's such a devastating conditions, these different leukodystrophies, but the patients and families are the most generous, warm, loving people I've never met. And so that's really stuck with me. And I have found that as well in the clinic of just wonderful patients and families. And so we feel really honored and privileged to be up here with you guys today. Oh, use the mic. Okay. Yeah, so here's me in our Lurie Children's Hospital in downtown Chicago. If you come and visit one day, you'll see like a large whale hanging from our lobby because we collaborated with all the museums. And so we have, you know, I also put up in the pictures some things that help me with self-care as I work in social work. But I got my master's of social work in Columbia, New York. I have an MBA on top of a social work degree. And in addition to working, I'm the co-founder of our Diversity, Equity, Inclusion Committee at the hospital, active on the National Organization of Rare Diseases DEI committee. I'm an ethics consultant for the hospital, and I've been in the genetics department for over 12 years.
Okay, so who is the pup?
Oh yeah, my Maisie, my corgi,
Oh.
gives really great hugs, and so definitely helps me with self-care.
Awesome. Okay. And this is a little bit about me. I am from the Philadelphia area. I have both a bachelor's and master's in the field of social work from Westchester University. I was the social worker who actually helped start our leukodystrophy center in 2015, and I've had the joy of being with them as it's grown and grown and grown and grown and grown. And I've been in outpatient neurology since 2014. We have a bunch of funky, I think you can't be a pediatric institution without fun colors and funky looking buildings. So that's a couple pictures of Chop. That is my son, Dexter, there. He's a little bit of an old grouch, but that's okay. We love him anyway. And my Taylor Swift inspiration, I thought could make it into the presentation. Okay, next, we're going to be talking with Marcy. She's sharing her son's diagnosis journey with us today. Thank you so much, Marcy.
Thank you for having me. I'm Marcy Flores. I'm the mother of a 19-year-old son that is affected with 4-H leukodystrophy. I'm also a board member of the ULF, and I just recently joined the Yaya Foundation last week that focuses on 4-H leukodystrophy. So thank you for having me. I wear a lot of hats professionally. I am a bilingual communication specialist. So I serve the Latinx community in the greater Illinois area. I work for school districts. So professionally, I do a lot of work in family engagement. And I'm currently a grad student at NEIU trying to implement some strategies on getting carving pathways for Black and Brown communities into higher ed. So that's a little bit about me. My son is 19. He got diagnosed similar to your story at the second opinion program here at our annual conference in 2009. So the conference is a very, it's a way to meet families. It's a way to connect. It's a way to come together and feel a sense of belonging. So I applaud you for being here. It means a lot to a lot of people and for many reasons. Our journeys began in 2009, February, diagnosis D-Day. A lot of us know that. We know what we were wearing. We know where we were. We know how we felt. I can verbatim tell you from start to finish how I got my son's diagnosis over the phone. That's generally how I start our journey. And we were told in such a way that we had to prepare for the inevitable, that my son was not going to be here for and much longer. That was in 2009. We are in 2004, and my son celebrated his 19th birthday 2 weeks ago. So don't ever let anybody tell you that it's a textbook classic case of leukodystrophy, because you don't know. So never lose hope. With that said, in 2009, when I got the diagnosis, February 11th of 2009, I'm telling you, I remember everything about it. I was in undergrad, and I was warming up my car in a cold Chicago wintry morning, and I don't know how I made it home. I received the news over the phone, and the trajectory of that, and the impact of the way that I was told in such a clinical, sterile way really propelled me to be an advocate for my son. That set off in motion how I am today as an advocate. And not everybody has the ability to speak up and advocate for their child. You're lost, you're overwhelmed. There's a lot of information to discern. You don't have the right tools and resources. I had no background in science. I can write a paper, a 20-page paper, but statistics and math scare me. And body functions. So I did not understand the human body whatsoever. And now, because of this disease, I know more about the human body than I ever anticipated, right? The reason why I'm here today is to share my story, to give you empowerment, to be able to take what I have to say back to your homes and your families and your community and build a community. You have to build a community. When you first receive this diagnosis, you're going to feel lost. What did I do? Self-blame, all the emotions, right? All the feelings. And it's okay. It's okay to feel all those feelings, right? As a matter of fact, I host every other month. I host caregiver support groups. If you want to know more, please come by and talk to me about it. Sanctioned by the ULF. But more than anything, when you align yourself with the right people and that help you navigate through this uncertainty, that's going to be your roadmap. You have to build a blueprint. You have to build a roadmap. You have to not be afraid to ask questions. It's okay not to have those answers, right? And more than anything, you have to fight. You have to fight for everything. You have to fight for an IEP meeting. You have to fight for, for insurance to cover this medication, insurance to pay for this, insurance to pay for that. Oftentimes we have to fight with our employers to be seen and to be given some flexibility because of the illness that is plaguing our families. I've fought a lot over the years with many different organizations, companies within my own employment and professional setting, right? So that was my roadmap, is making sure that I align myself with those right people that help me navigate through the complexities of insurance, of education, barriers, challenges, deficit thinking, and deficit thinking of your child or your loved one as a deficit. Like, that's not going to help. What's going to help is you aligning yourself and making sure that you make those connections within your communities and building your communities. And it's not going to happen overnight. You're going to cultivate those relationships throughout your time, and in many different ways. And I shared this before, it was the worst thing that ever happened to my family by far, but it's also been the best thing that ever happened to my family, because I've built so many relationships. My best friends are leukodystrophy families. I can call them up. Hey, what do you think about this? Hey, what do you think about that? We're constantly giving each other information, feedback. What do you think about this? Teaching each other. And then what do? We go back to our children's providers and we teach them. Just a few weeks ago, my son is being seen by a new physician now that he's transitioned out of pediatrics into adult care. And the doctor said, "Can you please teach me?" I don't know anything about leukodystrophy. I don't even know how you got my number, or I'm happy that you're here. And of course, I'll take on your son as a case, but I'm going to need you to help me. And when a provider asks you that, that sets him or her apart because they want to know more about your child's illness. And you're going to, for those of you that have younger kids, the time is going to go by really fast. All of a sudden, you're going to be like, oh my gosh, they're transitioning from K through 8, and then now they're in high school. And then after high school, it's the adult care. So it's going to go by really fast. And if you have those built-in communities where you can go and bounce off of each other, because even if you have a spouse or a partner, sometimes it's hard to talk to each other. Your spouse may be the one that's the strongest, and they don't want to be vulnerable in front of you because they're used to being a certain way. You're used to being a certain way, so you don't want to burden each other. So that's why you have those external communities to be able to help you. So I'm here to help you, and if you want to have side conversations with me, I welcome any questions that you may have.
Thank you so much, Marcy. I really appreciate that.
So we understand that not all help is helpful, and we got these comments from families and patients. And so there's something called toxic positivity, where people might just say these comments to you, right? And so it's, you know, as Marcy was saying, surrounding yourself with a supportive community. And so, but also setting boundaries with people who are not so helpful or supportive, right? So it's very important for, you guys to know that you have the power to select who's in your care team.
So we want to talk a little bit today about building a toolbox. So naturally, as a social worker, my brain goes in two different directions when I meet a family who's newly diagnosed with leukodystrophy. Because immediately I want to support them in every emotional way that I possibly can. I want to help with their grief. I want to help with their coping and their anger and their frustration. But I also acknowledge that with a new diagnosis comes a lot of stuff. And many families, well, no families, typically go to school to learn how to take care of a medically complex child. It doesn't exist. So overnight, many of our families are thwarted into this world and having to learn how to navigate a lot of things. So we built today's discussion to hopefully be able to address both sides of that spectrum. So some concrete, logistical, maybe paths forward for things that may be contributing to your mental health, and also ways to take care of yourself, which, by the way, is a very difficult conversation to have with caregivers because caregivers are always caring for others. So today we're going to delve into each of these a little bit more, but we're going to talk about building your team, the benefits of connecting with the disease community, as Marcy was discussing, resources and connections that can help lighten the load. We'll talk about navigating the healthcare system and making the most out of your medical care, and then navigating relationships, changing relationships, processing grief, building resiliency in yourself and your family, and reframing hope, and then your self-care survival guide.
So in these next two slides, we talk about, building your team. As I was preparing for this talk, one of the parents said, please tell all the parents to get a therapist right away, not only for the caregivers, but also for the patient and the siblings. And do it in a time when things are calm, because they're going to be teaching you, coping strategies when crises do come up, or being there with you, through the journey. So finding and therapists also finding the right fit of someone who really, fits well with you, who can be supportive. And in terms of, as you also build your team, looking at, been family, you think, oh, family's going to be super supportive, but it could be good or bad, because some families might, be causing you more stress. And so also setting boundaries and allowing those families that are supportive into your network and siblings. A lot of in a session prior to this, Sarah was talking about in the sibling session, the concept of the glass child, of one of the siblings maybe feeling invisible. And so as the identified patient gets so much attention, making sure that you are, having special time set aside for the sibling. I know there's a sibling session tomorrow in this conference, but and being very sensitive to the siblings' needs. There are so many great community supports in our community. There's a Lightways palliative care program, and they have music therapists that could come into your home. We have a division of specialized care for children, and they could pay for aqua therapy and things that are not traditionally covered by all insurances and equipment. And then, most hospitals or healthcare organizations have a chaplain, but they're really trained in not only helping provide support from religious, if that's what you want, but it could just be spiritual care and being sensitive that not everyone has identified religion. We have a child life therapist here, right? Do you want to say something about child life and? Mhm.
Child life special. Oh,
Yeah,
yeah, I know.
It's official now.
it's official.
I think as a child life specialist, we're here for family support to help the siblings and the patient understand what is happening, what's going to happen, the diagnosis information, as well as procedural information of what to expect. And then, as Sarah and I talked about earlier, the trajectory and the progression of the disease, and the support that we can give while they're with us in the hospital.
Yeah.
And sometimes clinics too.
Yeah.
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 Thank you so much.
Thank you.
Thank you, Laura.
Yeah. So there's so much. We have medical legal partnerships with, legal advocacy. And then there's so many disease specific organizations, which we're going to talk about in greater length. Marcy, do you want to say like maybe one team member that was particularly helpful for you? And
DSCC.
Okay.
So and I learned to navigate all this by myself. And we're gatekeepers of information, right? So it is our responsibility to be able to pass on the information that we learn and give it to other families, right? That's the only way that we're going to be able to move forward as a community, is by not gatekeeping information. I'm not saying that it happens, but I've seen it in other ways, and not necessarily our community, but it's very important for us to share resources and information. That's the only way that we can move forward, right? But DSCC, Division of Specialized Care for Children, I actually interned for them because I wanted like the insights. I'm, as you can see, I'm going to try to put my hands in every pot because I want to advocate for my baby. He's still my baby. And I know not everybody has that personality, but the DSCC, and it depends on your region, it depends on your state, it depends on the funding. As you see, a lot of times there's some polarized issues with like funding within our communities, local government, things like that, things of that nature. But I learned an incredible amount through DSCC on how to navigate insurance. A case management approach is always the best approach in my experience. When you are aligned with yourself, aligning yourself with an organization, somebody that's like a case manager or like an IEP manager that can help you navigate, that would be like somebody that you should rub shoulders with and like have them on speed dial, because a case management approach is really how you're going to get information.
thank you so much.
So it may be a little confusing when we're talking about mental health, but also talking about community resources. And that's because, you think about all the different areas and the different parts of your life that you get support from. And things like wish granting organizations is something I bring up very early on in a diagnosis of leukodystrophy for several reasons. But number one is that, the whole purpose of wish organizations such as Make-A-Wish is to give an experience to the family that provides them with a break from the day to day, and to give them an experience that they can experience together as a family. These are a few that I work with very often. Some are more are more location specific or age specific. So, but can be a wonderful opportunity for your family to be able to connect. We spoke before about disease specific organizations. There's far too many to name. But there are a significant amount of benefit to connecting with your disease community. With that being said, I also acknowledge that all of this that we're talking about today has to happen in your own timeline. So we work with a lot of families where sometimes connecting with the disease community may not be their first avenue or area of support. And that it may take them a while, or if at all, to be able to connect with other parents. When they do, however, there's a sense of belonging that I think is so unique and so cherishable in that area that is unlike any other level of support that you can get. It provides you with support, understanding. You have shared knowledge and shared experiences that truly only a small group of people understand. It can promote your emotional well-being. And then the number one reason why I point families to other families is because they know all of the best information, as Marcy said. The empowerment and advocacy that comes from being an involved parent in some of these organizations is really powerful, because oftentimes the parents that do work in these organizations, the work that they do does not just affect their child, it affects many children. So just being able to give back like that can be an excellent way for you to exert your energy. And then, as Marcy mentioned, friendship and camaraderie. The friendships that are built out of a unique experience, particularly in rare disease, I think is really beautiful and unique.
Yeah, so I'm going to go into living with leukodystrophy can definitely have a financial impact, not only because of the multiple medical appointments, but also you may not be able to work because of all the caregiving needs. And so, it's really important to know. I know people here are from all different states across the country of going to this kidswaivers.org to find out. It's a very reliable website that tells you for going state by state, what are the waivers available in your particular state. Social Security disability could be super helpful, not only because you could get a monthly check, but also for adults, you could get Medicare, which covers at a better rate than the Medicaid insurances or other insurances. And also these charitable grants, there's so many, but when you identify the ones that could be supportive, have really helped some of our families, not be evicted from their apartment because of at that time they were facing a financial crisis or help for utility costs or other expensive changing, adapting their vehicle, to be wheelchair accessible. There's a lot of different loan closet programs. Families have told me how long it takes to get a customized wheelchair. And so some of these equipment places could loan a wheelchair while you're waiting. And so definitely a lot of great resources. Also, there's a lot of education, federal and state laws to help support the leukodystrophy patient as they're in school. So there's a medical 504 plan that could help with accommodations related to, being able to get a special pass for the elevator if you're in a wheelchair, or gym modifications, or extra time, with the tests. But then there's the individualized education plan, which could help actually modify the curriculum. And so these things could, or you may, be taking more days off from school because of all the medical appointments. So putting these in file, helping link your medical team to the school to help educate the teachers and the staff could really be supportive and helpful.
So another huge stressor for families is navigating the complex healthcare system. And anytime I talk about health insurance or the healthcare system, I use this graphic because I feel like it's what the inside of my brain looks like when I call an insurance company. But as I mentioned earlier, a new diagnosis of leukodystrophy comes with a crash course in healthcare literacy. There are now some online resources that can help you with understanding some insurance terms. There's one available on the site there, but even simple things as understanding terms that maybe you've never heard before, like deductible and coinsurance and things that really can cause a significant amount of stress. Guarding yourself with as much information as possible is truly key. Get an insurance case manager. An insurance case manager is a direct person at your Medicaid or insurance company that can help you with navigating specific stressors. If anyone in the room has an experience calling an insurance company, you'll understand why we included this in the mental health talk, because it's a stressful experience. And we want to try to enlist the help of anyone that we can in order to alleviate some of that stress. Ask the hospital what they can take off your plate. The hospitals oftentimes are equipped with case managers and social workers, and they can help you. They can sit on the phone and they can sit on hold, so that's one less thing that you have to do. As Marcy said, you are your best advocate, but it's also okay to pause and ask for help wherever you can. So making the most of your medical care. Doctor's appointments can be incredibly overwhelming, and if you come to CHOP, incredibly long. So I know our appointments have a lot of people. I'm not going to name them all. You see a lot of people, and it's several hours long. We tell families to come equipped with food and games and activities. We try to take little ones for like little adventure walks because we know that it could get boring. So a few things to just keep in mind. Try to just make the most of your medical time so that it's in the long run, you're actually saving time. So if you're going to see a new physician, making sure medical records are sent beforehand. Have like a sheet of paper or a folder that's just like your medical grab folder that's got like your meds, your allergies, any surgeries or discharge instructions. And that way, that's just the folder that you take when you go to the doctor, and it's all in one place. No logistics. The number one thing I think I talk to new families about is where on earth do you park in West Philadelphia to come to see us? But simple things like that, we're talking about like stressors, like where on earth am I going to park? So getting those questions answered is a huge component of alleviating and decreasing some of that stress of going to the doctor. And bring questions you have for the physician. I often tell families, you'll be washing dishes and something will come up and you will think, oh my gosh, I have to ask the doctor that next time we go. I usually tell families I'm old school, so I like to write things down, but keep like a notebook, just like in whatever the most popular room of the house is, so that when that question comes up, you can like pause and write it down. Or if you're techie, open a notes app and keep it on your phone. Because I can guarantee you that when you go to the doctor, you will not remember that question that you were thinking of when you were washing the dishes, and it'll be frustrating. So try to just bring that list with you. And then that way, when you leave the appointment, that physician is there to sit there and answer those questions with you. So make sure you just go through everything that's on your list. I think we went through most of these. Arriving early, making sure all your questions are asked. Another thing I like to just encourage families to do is when it comes to action items, I don't know about you, but when I go to the doctor, I leave sometimes confused as to, okay, what was I supposed to do? What are they doing? How's the script getting wherever? So really making sure that those things are incredibly understood. Like, okay, what is it that you're doing and what is it that I have to do in terms of next steps, just to make it as clear as possible. Take notes or bring someone with you to take notes, especially for big appointments. Particularly, anything that you feel like may be complicated or beyond your understanding. And I would even go as far as to say, bring, a support person that maybe is not directly involved in your family's life. So that, if a house has two caregivers, that doesn't mean, the other caregiver may be the one that's able to take notes and really comprehend what's going on because they're feeling just similarly to how you're feeling. But to bring another person to take notes can often be extremely helpful. And please, by all means, join your hospital portal if you haven't already. My chart, my chop, whatever they call it these days, is absolutely wonderful. You oftentimes will get much quicker responses than by calling into the healthcare system. It's also another way that I think our families just have access to healthcare in a way that they never did before. So when it's 11 o'clock at night and you can't sleep and you need that med refill, you don't have to wait until CVS opens the next morning. You can just send a message right then and there when you're thinking of it and have the physician take care of it first thing in the morning. Okay, so moving right along, we're going to kind of segue into some more specific mental health topics. And one of the things that we know really changes when our kids get diagnosed with leukodystrophies are the relationships and the roles we have in our lives. And this can be extremely challenging because oftentimes we have an established support system, and then something like a new diagnosis comes along and just kind of flips everything topsy-turvy. And everything has to kind of get refigured out. So roles become reestablished. People who were perhaps in caregiving roles before become ones that are maybe receiving care or vice versa. Breadwinners, people who are bringing in income, those roles may change within the family. So to just navigate that with a lot of grace, giving yourself a lot of understanding that change is difficult, and that's okay. One of the most important takeaways, I think, when we talk about changing relationships is open communication. I talk with many parents who are coping with a new diagnosis of leukodystrophy. And one of the things that I point out is that you're never going to have two caregivers or two partners oftentimes cope exactly the same way. They're not going to process grief, process information the same way as their partner. So to understand that gives that person the space that they may need in order to go through their own grief process. Communication amongst partners can help reestablish those roles and set realistic expectations of what you may need from the other person. Educate others, I say, but not at the cost of your own well-being. I always say, and Sue said this yesterday, we love the analogy of the oxygen mask on the plane. We've all heard it. But having to put your own oxygen mask on first, it's so simple, but yet so hard, I think, for caregivers to put themselves first. So really to kind of keep in your mind that we understand that the weight of the world is literally on your shoulders so often that it's more imperative than ever that if you take on tasks like taking care of your family and being a caregiver and taking on helping to educate the community and to be an advocate, that's a lot of hats. And it's remarkable that so many people in the leukodystrophy community do it. But to also remember that you can't do a lot of those things unless you take care of yourself also. So we'll talk a little bit more about that a little later. And to really focus on quality time together. Time may change. What you're doing with your family may change, what you're doing with your friends, what you're talking about, even how you're taking care of yourself must change. But the focus on the quality time that you do have, both with yourself and your family. And of course, seek professional help. Anytime relationships or roles change within a family unit, it can oftentimes create a lot of resentment. It can even produce some frustration and some anger. So it's always good to have a professional that you can speak to help you process some of that change.
So we are in the grief and grieving slide, and Marcy wanted to share with you her perspective. Just here.
So grief, the old school word would be mourning, right? But we're gonna evolve that into grief. In my opinion, in my experience, it's a spectrum, right? It's a journey. So what you may feel today in the early years of the diagnosis versus how you are in 5, 10 years from now, it can very well change. And you can also be sent back to those dark moments where you first learned about the diagnosis at any given moment. Washing dishes is a great analogy. I use that all the time. Your mind, it's, or you're driving and then all of a sudden you get to your destination and you're like, how did I get here? Because you're in your head, with those thoughts. So grief is an ongoing journey for us. There's no escaping it, right? How you choose to grieve depends on your cultural beliefs, your religious, spiritual beliefs, right? But knowing that it's okay to have those days where, and writing, it's like riding a wave. Mindfulness is a really good way that I strategize that grief. When I realize that I'm having those moments where it's a moment of despair. And let me share something personal that happened this morning. My son fell off the bed. He was supposed to join me today. I haven't even told you. My son fell off the bed this morning. He was supposed to join me later today with his dad, and me not being there is killing me. I know he's in great hands, and I know things are gonna happen. He's wheelchair, he's blind. Unfortunately, it was an accident that happened. He was with his nurses. But my mind is over there. And I'm grieving for the times where I could be in the next room and he could be sleeping and I don't have to worry about him. So it's a wave. So I'm riding that wave right now. I'm going to come down that wave and I'm going to accept things for what they are. I'm going to meet the day where I am. I'm going to accept those feelings and then align myself with those relationships that I've cultivated to be able to foster and promote wellness. Because if you don't, you're going to be in that dark place and you're not going to be able to get out. And if you can't get out, you can't be much help to your family. You can't be much help to yourself.
Yeah, I'm so sorry. I didn't know that.
Yes, I know.
Okay, okay. Mhm. So self-care and taking care of you, right? And building your own, what are things that replenish you? What are the things that deplete you? And building up all those things that replenish you. What are the tools that work for you? Some people like the mindfulness meditation. Other people say, they can't sit still for that long. So, there's things that we can control and there's things that we can't. And also, that could be very powerful. I know a mom, when her child was hospitalized, swimming really helped her. So even to swim for like 15, 20 minutes and then come to the hospital really helped her for that month-long hospitalization. So finding those things that, you could incorporate into your life, leaning onto your supports as you build your team, as you build your support system. And then also we talked about the boundaries. Is there things people do for self-care that anybody wants to share that, you could share around these resources to each other? Go ahead. Do you-
I really enjoy gardening, and I think that plays into the mindfulness. Where I'm listening to the birds and trying to go like plant by plant, and I think that kind of building those moments help kind of keep my thoughts from rushing.
Mm-hmm. And being in nature is so important.
Yes.
Yeah.
Yes.
And then you could
That's
eat
so
the things you
important.
grow, right?
Yeah. So I too am a gardener, particularly, and it's interesting because I am not a good gardener, but it's almost like an unspoken language between my husband and I that he knows, like when he comes home and I've got like dirt all over my hands, or I'm just like that I had a bad day or that I had to have a difficult conversation. And I agree. I think it's something about like being outside and just being so connected to nature that just it's like an automatic pause, like it hits a pause button. So just to show you don't have to be good at anything in order for it to still serve a purpose. It's self-care. Yeah. Pulling weeds out.
Beautiful flower at the end.
Yes,
Oh,
exactly,
beautiful. Nice,
exactly.
nice.
Awesome. Okay. We're also going to talk a little bit about reframing hope. So when a lot of our families get this diagnosis, hope is a really difficult thing to talk about because oftentimes as physicians are having these conversations, um, the conversations can be incredibly scientific. And oftentimes, sometimes the medical community doesn't often think from the perspective of, okay, how do we retain hope? Because hope is still there, it just changes. So even if we have a disease that doesn't have a cure, that doesn't mean that there's no hope. And it doesn't mean that hope just goes out the window. So hope just needs to be reframed. It can change, it can go away for a while, it can reappear, but it's a pathway. And it's a pathway that everyone is allowed to stay on. It's not a sign of weakness. Hope is not denial. So saying things like just reframing hope, it does not mean that you're not cognizant of what's going on, or the realities of the situation. It's just holding on to hope because that's your right to do. And hope can change and morph over time. So as a child, as a family who's received a diagnosis of leukodystrophy that I've recently worked with, we've had a lot of conversations about reframing hope, and they go sometimes from, okay, so there's no cure. Okay, well, I hope for a treatment. And then, okay, so there's no treatment. Okay, I hope that the really expensive wheelchair that we need gets approved. And then that happens. And I hope that that another family doesn't have quite the new diagnosis experience that I had. And so hope can be defined in so many beautiful ways that just because we work in rare disease where there are not a lot of treatments, it does not mean that hope isn't there. The image there was one year I had an artist from Texas make watercolor irises, and I gave them to all of my leukodystrophy physicians because the iris means hope. And it's something that I think we take really seriously in our clinic to be able to give that message to families.
Some chat as you went through the presentation. So I had one about from Katie. She said, I have a podcast about my son and am a social media vlogger. It helps me get my thoughts out. And so I can read these now or later, her comments about, do you have a kind of Q&A toward the end?
Yes.
So I'll save the other parts because it was just different things that are happening in their lives.
Okay,
Yeah,
perfect. So going back to simplifying a healthy mind, one of the things that Sue said was about replenishing and depleting. We all have an energy bank, and it contributes to our overall mental health and mental well-being. And if you think about it just as a math equation, what is adding, what's subtracting, what has to add, what has to subtract. And if you look at these things in that mindset, then it may be easier to identify like what is contributing and what is not contributing to your overall wellness. So that if you're aware that when your phone is ringing and it's Aunt Susie, and Aunt Susie has a lot of questions. She's got questions. She's been Googling. Aunt Susie with the Googler. She's been Googling, and she wouldn't say, that when you answer the phone, she's going to want to talk to you about something. And that is not going to contribute to your overall wellness. I give you permission to not answer that phone. And it doesn't mean that we cut out the Aunt Susies. It just means that in moments there may be moments where you have the ability to be able to exhaust things that are challenging, but you also are allowed to give yourself permission to say no when it's just too difficult or you don't have the energy to give. And this goes for a lot of things. This may be relationships, your job, food, sleep, simple basic necessities. Think about like what is working towards replenishing your overall wellness and happiness versus what's taking it away. And embracing small amounts of positivity, though challenging, can be very, very effective. And I know that that is extremely tough for a lot of the families living with a child with leukodystrophy. But I challenge you to find the moments or the pockets of peace and to just harness onto them and to remember them for times when it's a little bit more difficult. We're going to go into self-care. And remembering that self-care does not always look the same from person to person. And that it can look very, very different. So when I went to a doctor once who told me to do mindfulness or something, and they gave me like a list that like looked similar to this. We've all seen this list, right? Like anyone who's said like, I'm upset. Somebody's given them this list. Somebody's Googled this list for them. And I'm like, wow, I'm going to be really busy. That's a lot of stuff to do. So things like meditate, walk, journal, exercise. Of course, some things on here are fantastic. A lot of things on here are fantastic. Are they realistic? I don't think so. So I start thinking, there we go. I start thinking about like, what can you do? What are the things that you can do? Because maybe it's not everything on that list. Maybe it's not half the things on that list. Maybe it's not a quarter of the things on that list. But one of the things I like to just start with is taking time to remember your breath. I can't tell you how many times I've had parents tell me, you don't just like forget to breathe sometimes. And I know what they mean. It's because they're so unconscious of their breath because they're not present, because they have so much on their shoulders, that even doing something as simple as just remembering to breathe or to pause to take a mindful breath or an intentional breath can be positive. So this is not us telling you to complete the left side list, but this is us telling you to find an outlet, to find a pocket of peace, even though it may seem really difficult.
Yeah, and there was a common theme of gardening, so maybe next year we should have a session on gardening for self-care.
Yes.
But did you want to, now is a good time to have those comments from the virtual audience?
Okay, this is also Katie. She said, I connect with the rare disease community through social media. I have a few people I talk to within our diagnosis in an online Facebook support group, but sadly, a lot of them have kids so deep in the disease, they're not very communicative. So it can still be isolating if you're at all different stages of the disease. I wish we could get more help with getting special beds like Cubby. And we're also having a hard time getting funding due to our son's age, not his diagnosis. We're in North Carolina. My son's case manager doesn't help at all. We also have we have to drive very far to see our son's doctor, and age. I asked the question because a lot of times age is 18 and then you have all these problems or transitioning to adult doctors, but she said that's not the case. This is, her son is almost 3 and doesn't qualify for a lot of programs because he's not yet 3. And he can't get SSI because they have 2 vehicles. So they've been denied due to assets. So those are her comments.
Yeah, no, it sounds very frustrating. If she wouldn't mind sharing her contact, we'd be happy to reach out and talk to her more and find help in her resources. Also, I have found the United Leukodystrophy Foundation, like me and Sarah, even though we're social workers in the field, and they have such a wealth of resources. And so they've been helpful, but happy to help her research resources in her area.
Thank you.
And I think another thing to highlight from what Katie said, and thank you for sharing that, Katie, is that that's not very atypical, right? Like, so oftentimes we have support systems that are in place to support us be unsupportive, such as case managers, schools arguing with us about IEP accommodations. We talked in the beginning about how not all help is helpful. So it's important even more to kind of cast your net further, similarly like with Katie sharing that today, so that what you need gets to the right person. And I can't argue, I can't stress this enough. Utilize your medical team, that when you feel as though that there are things that you are not getting for your child, whether it's in the community or whether it's a piece of equipment, to really lean on your medical team, because they are a group of professionals that do have an understanding of the complexities of these types of diseases, and just to give yourself permission to ask for help, that you don't have to do all of this on your own.
Other questions? Yeah.
Support, thank you. Supports like this, it's very helpful, but outside the framework of the US, I think there's limitations in varying degree of support. So are you aware of any helpful supports for people from outside the States?
Yes. So yes, there are support organizations that I feel like are international. Additionally, some of the resources, though they may be called different things, I think still could exist. Like maybe not the financial or community support services, but just the basic building blocks of kind of what is needed in order to build your team, in order to build your community, I believe really could exist anywhere, just perhaps under a guise of a different name. I can definitely send you some of the international information as well.
Yeah, Make-A-Wish is international.
Oh yeah.
And Marcy says, and she said to put a plug in that they're doing a session today at 4:00.
Yes.
I'll be sharing my story.
Yeah, but thank you for the question. Any other questions or comments?
I was curious what your suggestion is for someone who might be very shy or very private, who maybe should talk to someone, but they're kind of resistant in that way. How do you help someone like that?
So my husband's like that. He's not like me. But so it took my husband about 7 or 8 years for him to really understand the disease and accept it. It takes time, and you don't give up on that person, in my opinion. I think it's a slow progress. They may not be receptive right away, but that you kind of like date them, right? You take things slow with them, and you just introduce yourself, and you introduce some of the resources, and then I would even invite them to watch you advocate. My husband, it's like I said, it took him a really long time for him to accept the disease, and he talks about it now. He's very open about it. He sometimes leads men's group, and this is a husband was in the military, very stern, quiet, a man's man, and now he's talking about feelings. Right. So it's not for everybody. Not everybody's going to talk about feelings. Feelings are very private. But if you have that person in your life or a family, I would almost say don't give up on that family, and just make sure that they watch you advocate. You give them pointers, you give them tips. They sit, and sometimes they just need somebody to listen to. So that's in my experience, it's been like that. It took him a really long time to accept it. He's here now. My son's 19, advocates. He's at the ER right now. I mean, it just happened. He just fell off the bed like 2 hours ago. So he's in the ER right now with him. And I know for a fact that my husband's going to give him the weight, the height, everything he's like an extension of me. Right. So, and it took a really long time to get here, but we're here. Right. So you don't give up on those people. It's just my experience.
one of the other things I say is that, I mentioned earlier that no two people's coping skills or processing is the same. And that can be so frustrating, right? Like, because there's a perception sometimes that comes with that, particularly in a partnership where some caregivers are like, okay, I need to get online, I need to be connected, I need to talk to another parent who is going through this. And then we'll have another parent who is the exact opposite, who may isolate and may withdraw. They're both grieving, and neither one of them is grieving or not grieving more or less than the other person. That's an infinite type measurement. But without the respect of just acknowledging and giving some space and pause on the other person's coping strategy, I usually say that, to just be respectful of it, particularly if it's not harming them. Now, when of course, there's, all sorts of possibilities, like when families truly do not get the help that they need, that there's always a possibility that we could see poor coping skills and poor processing. And that's extremely individualized, of course, but I echo what Marcy said, and just with not giving up hope while still taking care of yourself as much as possible.
Comment on that. Also, I have a daughter with leukodystrophy. My husband is like Marcy's husband was, and he's just starting to talk about his feelings, but he also isn't all or nothing. So he's an all or nothing kind of person. So he's very positive and very now. So if she's happy now, he's happy. So if he grieved kind of how I did, he would be mess, like an absolute mess, like not helpful to anybody and himself. So he was super, super, super slow. He's just kind of getting more feeling going just between us. And then I also have another friend who a Facebook mom who she's painfully shy, I think. I don't know her very well, but she can't talk about it. She just happens to live where I grew up and knows a cousin of mine and who said she's very sweet. She can't talk about it. So her daughter has a disease. It's got a clinical trial. So I'm like, this is crazy. Like you're just jumping right in as there's a clinical trial. This is nuts. This is not how it usually goes. But she doesn't want to talk about it. So I asked her, I said, every once in a while, can I just send you something? And every once in a while means like every couple months. I just send her like, here's clinical trial registry. Here's news about this clinical trial. It's amazing, because she doesn't want anything to do with it. And it's one of those diseases where her kid is okay right now. And so she may get out of this wonderfully, just, walk right into a treatment. So that's, some people are just different. So yeah, it's hard, but I'm like a little gentle nudge kind of person every once in a while. That's how I've dealt with it. But thanks.
And meet people where they are.
Yeah. Yeah. Meeting people where there are. And then also, like, one thing that I feel like I'm hearing so much is just being cognizant of how much other people's grief affects us, like other people's processing, other people's, it's all interrelated. And that's even more of an emphasis on taking care of yourself. That, unfortunately, not all support is helpful, and that it's okay that to take a break or to pause or to step back from people that are on a different trajectory as you too, because you have to take care of yourself first, by all means.
Yep. Did you have a hand up?
Uh-huh.
No, my
Oh.
comment is, So, some of us really love to come to meetings and so meet everyone, but to recognize that isn't for everybody. And a lot of people would find a meeting like this or a workshop like this just horrific, and which is okay. And I think when you encounter a new situation, like a diagnosis of leukodystrophy, it feels like you know nothing and you have no skills or no abilities or anything. You just don't know what to do. But it is highly unlikely that it's the first problem that the shy person has encountered in their lives. And I think we have to be reminded that that we've all been through some kind of challenge or struggle before, and how did we get through it? And so rather than saying, well, are you going to go to this big giant meeting full of crazy talkative people and pushing it, it's like, well, you know, when you know, your dog got lost, or when this happened or whatever, what, you know, what was helpful to you? And usually we have a repertoire of experiences that are consistent with who we are, and maybe one of those would work again. So
Excellent advice.
And there's 5 minutes until the next session. Was there another hand over here? Mhm.
Yes, I just wanted to offer a quick comment. Thank you. This was amazing, and I was taking copious notes. And I'm going to stay for the next session to continue to learn. Because I guess, like, in reflection in rare disease, you know, I've worked in many rare diseases in my career, and I just want to assure the leukodystrophy community this is not a you problem. This is a all disease problem. And in my experience, there's no specific set when you put up that big list of things to do that are going to work in leukodystrophy versus another disease. But the other thing I wanted to offer was when you go to the doctor or your doctor's office, remember they're also grieving. You know, many times they've seen a lot of loss. So, like, I say that to just invite you to talk about your grief with them, because it will help them through the process too.
Mhm.
I can personally attest to that. I'm sure Sue can also. I was just telling a colleague this morning that I feel like, well, as much as I'm a social worker to our patients and families, I feel like I'm also there to support the physicians and the nurses and the genetic counselors and the team members that also experience this. So I fully commend that. I think that the more we talk about grief and the more we normalize it, the more then it'll just open up a conversation.
Mhm. Yeah, and at Lurie, we recently had a department it's like building resilience through grief workshop for all the staff, and like 50 staff members came. So it was really also something the staff were asking for as well. You're human too.
Thank you so much, everyone. Thank you.